Very happy to meet you all in another session in anatomy, and this is a very small session again on ligaments attached to the uterus. And now when we expect questions, we expect more picture questions, right? So you will be given picture questions like steps of surgery, like steps of say abdominal hysterectomy or steps of vaginal hysterectomy, and they'll mark the ligaments and they'll be asking you what this ligament is. Or the question can come from any basic theory point connected to the ligament. So before we go into the topic, I'll draw a rough picture of all the ligaments attached to the uterus and tell you all the basic points regarding all these ligaments, and then we will try discussing the questions. Fine. The first and foremost ligament that is attached to the uterus, we will talk with respect to ovary. So now this is ovary. We have a pair of ovaries, and we'll draw the lateral pelvic wall here for now this is a bone, this is a lateral pelvic wall. And with regard to the lateral pelvic wall, you should always remember that this position is constant. What position? The external os of the cervix is always at the level of ischial spines. Now this is regarded as a normal anatomical position of the uterus. So the external os is at the level of ischial spines, and ischial spines in obstetrics you call it a zero station, right? Now when the external os descends below the level of ischial spines, for example, there is a uterine descent where this external os is coming down below the level of ischial spines, then we call it as prolapse uterus. So that is the basic definition of prolapse. You all know prolapse is in fact a form of hernia. Yes, so uterus is herniating from its normal anatomical location. So the normal anatomical location is in such that the external os corresponds to the ischial spines. Okay. So now we have drawn the what to call, now this is the bony pelvis. Now this is the bone. Okay. Now talking about the ovary. Ovary is attached on one end to the uterine cornu, and other end ovary cannot just like that hang inside the pelvis. So the other end is attached to the bone. Okay. So how it is attached to the uterus? It is attached to the uterus by the ovarian ligament. So now this I'll shade. Ovary is attached to the cornu by ovarian ligament. Okay. Is that okay? Fine. Now, how is this side of the ovary attached to the lateral pelvic wall? Now, this side of the ovary is attached to the lateral pelvic wall by another ligament called infundibulopelvic ligament. Now, this is infundibulopelvic ligament. What is the other name for infundibulopelvic ligament? The other name is suspensory ligament of ovary. Suspensory ligament of ovary. Okay. So please now understand that during a hysterectomy, we will try with clamps. So during a hysterectomy, if you're going to retain the ovary, that means you're not removing the ovary, where are you supposed to apply your clamps? You will apply your clamps here. We will apply our clamps here. Is that right? If you want to remove the ovary also, then where you will along with the uterus. Okay, so along when you're doing hysterectomy, along with the uterus, if you want to remove the ovary, then where you will apply a clamp? You will apply a clamp here. Okay, so in the exam, I have seen picture questions like clamps applied on the ligament, and they will ask you what that ligament is. Is that understandable? Okay. Now we are talking about what? We are talking about structures at the uterine cornu. Okay. Please remember that the anterior most structure in the uterine cornu is basically the round ligament. This green color I'm drawing now, this is the round ligament. For me to draw the round ligament in a two-dimensional picture is very difficult, but I'll explain as a course so you can follow, and I'll show you with the real laparoscopy image. Is that fine? Okay. So the round ligament starts at the uterine cornu. In fact, the round ligament is the anterior most structure attached, cornual structure. Fine. Now the round ligament traverses for some distance, and I'll draw it in the opposite side. Okay. So and then what happens? It immediately enters the abdominal wall. So in the abdominal wall, you have the deep inguinal ring. Deep inguinal ring. So round ligament enters the deep inguinal ring. Now round ligament is a part of the inguinal canal in females. It comes out of the superficial inguinal ring. Now then it comes out of the superficial inguinal ring. and round ligament is attached to the external genitalia. Round ligament is attached to the external genitalia, that is, it is attached to the mons pubis. Okay, so that is the course of the round ligament. The length of round ligament is around 10 centimeters. Is that fine? And round ligament is comparable to what structure? It's the remnant of jubernaculum. It's comparable to jubernaculum testis. Okay, so that is all about the round ligament. So please remember that it is a content of the inguinal canal in females, whereas it attached, the other end of the round ligament is attached to the external genitalia, that is mons pubis. Okay, so remember that. So we have talked about round ligament, we have talked about ovarian ligament, and we also talked about infundibulopelvic ligament. Is it fine? So talking about the cornual structures, what is in between these two? We have the tubes. I'll show you with a better image, the laparoscopy image. So a small mnemonic here, I tell you, RTO. So you can remember like road traffic officer or something like that. RTO, round ligament. Behind the round ligament, you will have tubes, and then you will have the ovarian ligament. Is that okay? So from anterior to posterior. So you'll have round ligament, then you'll have tubes, and then you will have ovarian ligament. Is that fine? Now I'm going to draw another ligament. So in fact, the name ligament is a misnomer here. It is say sheets of peritoneum or just folds of peritoneum that is expansile on either side of the uterus and connecting the lateral aspect of the uterus to the lateral pelvic wall. Okay, so now these ligaments are broader, right? So they are called broad ligament. Okay, so on either sides you will have what? You will have broad ligament. And you all know broad ligament does not support the uterus in any way. Okay, this is broad ligament. So that is it. So broad ligament is just what? Two sheets of peritoneum on either side of the uterus. That's it. Now we are going to talk about the most important ligament. See, this is the most important ligament, and the name of the ligament itself is what? Important ligament. The ligament name itself is what? Important ligament. That means what ligament? Cardinal. So we are going to talk about cardinal ligament. Okay. Now this is the cardinal ligament. Cardinal, important. Cardinal ligament. What is the other name for cardinal ligament? McEnroth's ligament. McEnroth's ligament. It's also called transverse cervical ligament because it is extending transversely on either side of the cervix. So transverse cervical ligament. Okay, or you can also call it Bony's ligament. See how many names. The name of this ligament itself is important ligament. Now let me tell you why it is important ligament. Remember, this is that ligament keeps the external os of the cervix at the level of ischial spines. So what does it mean? Now this ligament is attached laterally to the cervix and it is attached tight to the bone. On the other end, it prevents uterine descent. That means this is the most important ligament which prevents a prolapse. Okay, so in the exam, they'll ask you a question, very often repeated question, ligament preventing prolapse. Is it broad ligament? No, not at all. Is it ovarian ligament? Is it infundibulopelvic ligament? Is it round ligament? No, it is McEnroth's ligament. If the question is asked in a different way like this, which ligament maintains the external os at the level of ischial spines, then also you say it's McEnroth's ligament. Now is that okay? Now, if we take the cross section of the cervix, so please remember this is basic anatomy. The uterus is not supported by strong ligaments because it has to expand during pregnancy. It comes up to the level of the xiphisternum, right? So it has to expand. So it's definitely should not be surrounded by strong ligaments. No ligament should hold it tight because it should be ready for expansion. Okay, but to prevent the uterus from descending down, the lower part of the uterus, that is the cervix, is held very tightly by a very important ligament, by a very strong ligament attached to the bone, and that is cardinal ligament. Now imagine the cervix is not only attached laterally to the bone, it is attached all around, 360-degree circumference. It is attached all around to bone very tightly, preventing the prolapse. So now if we take that, this is the cervix. Imagine now this is the cervix. Fine. Now this cervix is attached anteriorly to, we have this pubic symphysis, right? PS, pubic symphysis. Posteriorly, what we have? We have the sacrum. Laterally, what we have? We'll write this as lateral pelvic wall. I'll draw just only a small segment of the lateral pelvic wall. Okay. Now we all know what attaches the cervix transversely or laterally to the lateral pelvic wall. We all know that it is McIntyre's ligament, right? So we'll draw the McIntyre's ligament now. Now this is the McIntyre's ligament or the transverse cervical ligament. Anteriorly, now the cervix is attached to the pubic symphysis by pubocervical ligament. We will name it, okay? So pubocervical ligament. It's attached all around by strong ligaments. What is this ligament? Now this is our cardinal ligament or McIntyre's ligament. Okay. Similarly, posteriorly also it is surrounded by very strong ligaments, right? So posteriorly it is surrounded by what ligament now? Posteriorly it is surrounded by what ligament? We'll choose a different color. Now this ligament which is attached posteriorly, it's like a inverted V. Okay, you will have it like this, inverted V. Now this ligament is uterosacral ligament. Instead of telling cervicosacral, they have named it uterosacral. Not much difference. Okay, so now this is uterosacral ligament. Okay, now collectively the three ligaments. What three ligaments? Pubocervical, cardinal, lateral, transverse cervical, and uterosacral. Now combined all the three or together called what? Triradiate ligaments. They radiate in three different directions: anteriorly, posteriorly, laterally, keeping the cervix tight, keeping the external os at the level of ischial spines, preventing a prolapse. And among all the three, if they ask which is the most important ligament, strongest ligament, you will answer only cardinal ligament. Is that okay? Triradiate ligaments. Or simply use a triradiate ligament. Okay, is that fine? Now this is the whole important concept. Now let me go to actual pictures, laparoscopy pictures, and I'll tell you all the important facts. Now, this is all about round ligament. It is a homologue of Juma inoculum testis. It travels in the inguinal ring. Yes, it gets attached to the skin and connective tissue of the mons pubis and labia majora. Yes, okay. Now you can see from the cornu, it goes through the, this is deep inguinal ring, this is superficial inguinal ring. It comes out and it gets attached to the mons pubis and labia majora. Okay. Small additional point about round ligament is that it is supplied by one small twig of artery called Samson's artery, which is basically an anastomotic vessel between the uterine artery and the ovarian artery. So you all know where from the ovarian artery comes. Ovarian artery is a direct branch of abdominal aorta. Now it comes through the infundibulopelvic ligament, it supplies the ovary, and then it supplies the rest of the tube and the cornu. Where is the uterine artery coming from? Uterine artery is a branch of anterior division of internal iliac. So you have common iliac, internal iliac. Okay, now this is common iliac. In the common iliac, you have internal iliac and external iliac, and the external iliac continues as femoral. Okay, so I'll draw this. Now this is common iliac. Common iliac divides into internal iliac and external iliac. In the internal iliac, you have an anterior division and a posterior division. Now, this uterine artery is a branch of the anterior division of internal iliac. Now, this ovarian artery and the uterine artery anastomosis at the level of the uterine cornu. And we have a small twig of artery which connects the uterine artery and the ovarian artery, which is Samson's artery, which supplies the round ligament. Okay, fine. So, Samson's artery is artery to round ligament. Samson's artery is artery to round ligament. Is artery to round ligament. Is that okay? Okay. So that is all. Okay. So let us name. So you will have questions in the exam like this. Some number given like this, which will mark the ligaments, and they'll ask you all the name of the ligaments. Now this is a typical laparoscopy view. We are seeing the fundus of the uterus. Now this is anterior, and then this is posterior. So anterior to posterior, the uterine structures are, now this is This structure, I told you RTO, right? So you can imagine like this. Now this is a round ligament, and you can see the round ligament going like this and entering the abdominal wall. That is, it is going into the what? Deep inguinal drain. You have the tube here. And how are tubes identified? Tubes are identified mainly with the fimbria. Is that right? Now these are the tubes. Okay. Then behind the tubes, now you have the ovarian ligament which connects the cornu with the ovary. You can see the pearly white almond-shaped structure, that is ovary. And on the other side, this ovary is connected to the lateral pelvic wall by infundibulopelvic ligament. So this is infundibulopelvic ligament. So on the opposite side, I think I need not explain. And these and this is what this broad sheet. Now this is broad ligament. Okay. Now let's go to the orientation posteriorly. Whenever you see this inverted V-shaped ligament, always remember now this is the uterosacral ligament. You will not be able to see that mechandrods, pubocervical and all here, because only with the dissection you will be able to see all those. Okay, but uterosacral ligament, it's easily seen, inverted V-shaped. So what is inside that V? You see the deepest, or you see the most dependent part of a female pelvis. Now that is the pouch of Douglas. Now this is the pouch of Douglas. Pouch of Douglas is also called rectouterine pouch or rectovaginal pouch, or sometimes rectovaginal septum is another name given for this rectouterine pouch. And as you can see the intestinal loops going and lying inside the rectouterine pouch. Now, if this rectouterine pouch descends down as prolapse, now it becomes enterocoel. Okay, the content may be small intestine or content may be large intestine. Now, if you're going to name all this, 1 fundus, 2 round ligament, 3 ovarian ligament, 4 uterosacral ligament, 5 they have marked ovary, 6 it's IP ligament. Okay, so you will be given any question like this. Now this is a real a laparoscopy picture. I have 1 or 2 pictures, and now this is we will just do the same. Now this is uterus, fundus. Now this is anterior, this is posterior. Fine, you see the bladder here, you can see the bladder here, anterior relation to the uterus. You can see the pouch of Douglas and the inverted V-shaped infundibulopelvic ligament, pearly white structure. See the ovary, you're seeing the developing follicle on the ovary here. And now this is the round ligament. You're seeing the tubes and you're also seeing the fimbria here. Now this structure is the ovarian ligament, and the opposite side you have the infundibulopelvic ligament. So that is the orientation you should have to understand questions. Is that okay? Right. Now you see here anatomy is slightly distorted. Okay, so tubes on the ovary, maybe you will not, you can see this is the uterosacral ligament. You will see slight changes in the anatomy and all. This picture I have mainly made to show you the Mechandrod's ligament. Now this is the Mechandrod's ligament. Here one important thing that I want to tell you in the Mechandrod's ligament is that you have a tunnel for the ureter also travels through the Mechandrod's ligament, and that tunnel in the Mechandrod's ligament through which the ureter passes is ureteric tunnel, also called tunnel of Verdin. Tunnel of Verdin. I'll be talking more about the course of the ureter in coming classes. I'll be talking about relations of the ureter to the uterine artery. What we call here, this relation is water under the bridge, no? Now this relation is water under the bridge. Under the bridge. When you take the external os, 2 centimeter above the external os and 2 centimeter lateral to the external os, we see the ureter and the uterine artery crosses. What is anterior, what is posterior? You can easily remember by this. Water under the bridge. Water means ureter, urine. So urine is under the bridge, that is uterine artery. So uterine artery is in front, and behind the uterine artery posteriorly you have this water. Okay, so water is under the bridge, and this ureter will travel through a tunnel in the Mechandrod's ligament, and that is called tunnel of Verdin. And you also have nerve plexus, nerves of the inferior hypogastric plexus in the Mechandrod's ligament, which is called Frankenhauser plexus. So that is all, and I think we can end this by looking at the questions. Okay. So in this picture shown, I have 3 questions in order, and all the 3 pictures are steps of a hysterectomy. Is that okay? Steps of hysterectomy. I think we'll go to this original picture first, what we have drawn. and maybe I'll explain to you the steps of hysterectomy. So if it's a abdominal hysterectomy, where are we going to place our clamps? We will take our clamp. If I feel I don't want to remove the ovary, then my first clamp will be on the round ligament. So I'll remove the tube totally. Then another clamp on the ovarian ligament, clamp the broad ligament, also clamp the McIntyre's ligament. Now this is done on both the sides. Here we need to, when we clamp the McIntyre's ligament, just above we will have the uterine artery. So clamp the uterine artery carefully, and then the McIntyre's ligament. If I want to remove the ovary, I'll be applying my clamps on the infundibulopelvic ligament. So in the picture shown, this is the steps of hysterectomy. The clamp is applied on what ligament? So here this is the clamp. Okay, we'll shade the clamp now. Now this is the clamp. Now this is the clamp, and okay, so here where it is placed, now this is placed on the transverse cervical ligament or the McIntyre's ligament. Okay. Again, a similar question, clamps shown or applied on which ligament? So this is very simple. They are asking about this clamp which is placed here. Now this is a broader ligament. Now this is the ovary. Now ovary is connected here. How? The ovarian ligament, and ovary is connected laterally by what ligament? Infundibulopelvic ligament. So here clamps are placed on the infundibulopelvic ligament. So the last question, ligament that is marked by arrow. So please see this. Look at this picture carefully. The two clamps are applied, but here one ligament which is already cut. They have asked. Now this is the anterior structure of the cornu. So the answer for this question is round ligament. So please be very careful in answering. Most often you get picture questions from this ligaments attached to the uterus. So to sum up, we have talked about round ligament, ovarian ligament, infundibulopelvic ligament, broad ligament, McIntyre's ligament, tubocervical ligament, uterosacral ligament. Thank you all for your patient listening.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.